Hey guys, welcome back to the Clinical Breakroom Podcast. We have another guest here, Brian Smith. So we're super excited about interview Brian. He's actually a nurse as well, and you can say this is our first time actually interviewing a nursing author. So I'm super excited about that. We've interviewed, I think, one other nurse, yeah, one nursing entrepreneurs, and now we're interviewing a nursing author. So we're super excited about it. And just a preface here too, we have some history as well. Brian was actually one of our nursing educators when we were going through nursing school, which is pretty cool. So I'm super excited to dive into it. And Brian, go ahead and introduce yourself.
Well, thank you, Will. First of all, I want to say it's a great privilege to be on your podcast, and I follow you on LinkedIn and other places, so I know your wife very well, Alexis. I had her many moons ago as a nursing student, and I remember her very well. How sweet she was, how smart and bright she was. So I remember that well, and I'm really glad when I can connect with my former students who are now leaders in their field. But my name is Brian Smith, and I just to give you my credentials. When I was teaching Alexis, I had a master's degree. Went back and got my doctorate. I'm one of the few people, really, Will, who has achieved things late in my life when I should be home or in a nursing home, probably. I got my master's degree at almost 60 and a doctorate at 63. So people out there who think that you cannot do anything in your old age, oh, yes, you can. So never give up on that. And I always had a dream. I didn't really tell anybody. I didn't even really want to tell myself because I thought it won't happen. You can write a book, you can be an author. And I remember even when I'm sure I brought it up with Alexa's clinical group, this is going to be in my book someday. And I used to say a lot of sayings, and some in my group would write those down. I thought, what are they writing down? Every time I say something, they write it down. And at the end of the clinical group time, someone presented me with a notebook of all the little sayings I used to say. And it was just motivating things. So the book is titled Smart Lawyers Love Dumb Nurses. And I wanted a very unique title. I didn't want something that was just going to be blasé. I really wanted people to go through Amazon or wherever the book was and say, oh, wait a minute, what is this about? Now, it's not about lawyers, really. It's not putting down the nursing profession at all. I want to make that very clear. I wanted something very unique, and I would say a lot, and I'm sure I said it with the Lexus group too, smart lawyers love dumb nurses. What does that mean? Well, it has to do with being careful with your documentation, with being alert on your job, that you're not going to do anything like give the wrong medication. You're not going to chart improperly. That when you make those mistakes, you will possibly pay a price. And the two major ways that nurses get in trouble is with medication passes or with documentation. And so that's where the term came up with. I kind of just blurted it out one day, probably with my students. Smart lawyers love dumb nurses, and we're not going to be dumb nurses. I just thought, that's a pretty good title for a book. So that's where that came out, and it's out on Amazon, and it's on Kindle and so forth. And I'm hoping all my students will buy a copy. I made it very reasonable priced. So with all the hundreds of nursing students that I have out there, some hopefully will remember me and buy the book. So that's the breakdown.
Yeah, I absolutely love the title. Actually, it does catch up. It catches your eye.
Right.
When I first saw, like, when you were doing all this and you're announcing your book and everything, I thought that was, if you're a nurse, you kind of understand the title right away.
Right.
And I'm curious too. Lexi obviously had you as a clinical instructor. I unfortunately didn't. But I just from knowing you very shortly, I think you checked me off on one skill.
Yeah.
And I wanted to say this right in the beginning too, because you even though I barely interacted with you, I remember you
Right.
because you taught me something so practical that was like, I can still remember you taught me with the sterile gloves. We're practicing doing sterile gloves,
Right.
and you taught me crunch it up real quick and like squeeze it and break it down.
Absolutely right. I remember that. I remember you because I don't have that many males for one thing.
Yeah.
But I remember you took to that. You thought that was really a cool thing. Right. Yeah, because they stick. So, scrunch them together. They're still sterile because they're in the packaging, and you'll get them on easier. Right.
Yeah. I just wanted to like say that because like that was, I think that speaks to like kind of the person you are too. Is I barely that was probably like one of the only interactions I had with you, and then I'm not even kidding, for some reason it was like those practical type things that really stick with you, that make your job like easier along the way. And something as simple as that made a huge difference for me, so I thought that was cool, and I'm curious what Lexi has to say with going through clinical with you, because and then we can kind of dive deep into kind of reflected on how your book came around. But do you have any of those types of memories with him?
So I think it was the first day. I can't remember if it was like when we were orienting, or how we had to go in for the first day and just like meet everyone. But I remember, Brian, you were sitting in like the way back right corner, and like instructors were talking, and they were like saying like, you got the, I don't know, they were saying something motivational. But you stood up, and I remember you said, everyone breathe in courage and breathe out
fear.
Yeah.
Right.
And I still say that to myself today, like in anything in life. Like I still remember you saying, breathe in courage and breathe out fear. And I'm like, wow. So that was my first interaction with you. And that was before I even started clinical with you.
Right.
But in clinical, you were always very, like we hand wrote like notes.
Right.
And he was very, very specific on documentation. Like that was a big thing, that was a huge thing. So I can speak to that. When you say documentation is huge, and it's in your book, and I can speak to the fact that you put that on your nursing students, that it was very, very important, in our first clinical. But every time we would leave clinical, like all of us students were like, wow, we felt like we just left like this motivational speakers like convention. Like it was like so uplifting. And you would always say like, you have to be right within yourself and in your heart before you can be a good nurse.
Right.
And you would always, you had a book that you loved, and I have it written down somewhere, but you would always read from this book that you loved. And you're just very inspirational, and like you're like a big bear. like you're like a big soft teddy bear. Like you're like tall and big, and you're very quiet, but you're just a very good, loving person. So I appreciate all that you do.
Well, I really appreciate you saying that. I really do. That was a big auditorium where I first met some of you, and I did say that. That is in the book, by the way, because and I think one of the reasons why I say the things I say, it's born out of my experiences as a student nurse back in the 80s, before you were born, probably, where the instructors, the educators, were very unsmiling. I think they thought if they were kind to us, then that was going to make us enabled or something. But so I just thought, kindness is the way. And I really thought it's a way of life for me. I'm going to be kind, because when I would talk to a lot of you, and it wasn't just the two of you, but hundreds everywhere I've gone, they struggle with performance and not doing well. A lot of times it's because of the way instructors, educators speak to students. And I think that's one of the reasons why we have a nursing shortage, which we do have still, because of the fact that, there's some incivility in nursing, there's some bullying. If we're going to make changes and fix this problem of the nursing problem, that we have, this nursing shortage, we need to be kinder. We need to be kind to everyone. And one of my favorite sayings, which Alexis just talked about, is, if you're not a good person, you're not going to be a very good nurse. Be kind to your waiter, and be kind to people. Um, so I think it's a way of life. It's a philosophy for me. I remember one of the students I had at the school that you graduated from. She had to retake the class, and she did much better with me. And I said, well, what was the difference? Why did you do so much better? And she said, because you were kind to me. I said, that's it. That's it. She struggled, and I heard that a lot. So it's just a philosophy I take. It does work. We need more kindness in the world. I think we're in a society where we're seeing road rage and fake news and just so many things. So kindness kills the monsters, really.
Yeah, I agree. I think learning in a very stressful, just like you have so much stress on you. If someone's watching you doing a skill, and if you know that they have this, not hate, but they have this, like, they're trying to scare you, or they're trying, like, do you want them to fail? Like, are you trying to make them feel like they like are gonna fail, or what's, like, you don't learn under a stressful environment. No, not very many people do.
Well, we don't perform well when we're under the gun.
Yeah.
I believe that 100% what you just said. So we just don't perform as well. So I think it's just like, well, we're instructors. We're going to intimidate you. Well, that's not going to give you your best performance. It just isn't, and it leads to test anxiety, for one thing. I know you've talked about that, because I read your things on LinkedIn. Will, you talk about things like that? It's not our grandmother's nursing school anymore. Even the world that I learned nursing in, that world is gone. So we have to come up with a different way to teach our young people coming in. Let's be kind, and let's teach a different way. So
I agree,
Brian. I love, like, everything you just said, because, like, you pretty much highlighted everything that I'm super passionate about too. Is everyone's so, like you said, I don't know if it's whether they're coming from, I don't think any nursing instructors, trying to, like, be mean per se, but they are, their way of their minds thinking of that, I'm going to teach the student by being intimidating, or, coming across, you need to be, they feel like they need to come across as strict, or, they're coming across from intimidation instead of, guidance and acceptance. Because and you mentioned this too, and I'm curious to actually kind of backtrack and kind of learn about your experiences through nursing school. But from, myself to everyone I talk to in nursing school, is always the same struggle that you highlighted. Is, nursing school naturally, in my opinion, is already going to be stressful / give you lots of anxiety. Everything is brand new. Nursing is a whole new realm of things. There's nothing else like it. And no matter how much experience you think you have before you get into nursing school, this is a completely brand new realm of knowledge that you have to learn. So just being that right there alone is there's anxiety involved with that. And then, like you said, I think it's the wrong thing to do when nursing instructors come in and think they need to add to that, or come across. Sometimes they do say mean things. We had some instructors in our school during that time that would say some pretty brash things to you if you were to do something incorrectly, or kind of not, I don't know, they would scold you in a way, where they kind of make you feel dumb. So,
I remember that very well. I call it nurses behaving badly. That'd be a good title for a movie, I guess, or maybe a book. If I do another book, that might be the title of it. But nursing is stressful just because of the fact that you're learning a new language. You're learning the language of nursing, and you have to perform under the gun. And I just have learned that I want to be as positive as I can, because you're already suffering anxiety. And most students who start are in their early 20s, so they're still learning, how to face the world and
Mhm.
so forth. So they've already got some self-doubt as it is, and nursing's difficult. It's just very hard for a lot of reasons. You're dealing with people, you're dealing with sick people, you're doing things you've never done before, and it's one of the great professions in the world. But we're having trouble. I've looked at the studies. It's a worldwide issue with the nurse shortage. So we've got to come up with some solutions uh, to make it better. And with COVID coming, on the way it did, and everything else, it's difficult. Not to mention taking care of sick people is stressful enough.
Yeah.
Mhm.
So I'm hoping that people like you're young, people will follow you. I'm an old guy now. You're the future of nursing. I'm the past of nursing, but I want to stay in it as long as I can. So I don't intend to retire for a while, even though I'm at retirement age. But it's just things like the podcasts and the books that I've written that I'm
Yeah.
hoping to give a positivity. If you go to nursing school and study the instructors, you'll never pass. You've got to study nursing,
Yeah.
and you got to get past that. So
Yeah.
that's one of the things I wanted to put in my book, that believe in yourself and stay disciplined, because you can do it. I'm living proof. Again, I've done things that other people thought, well, you're too old. Well, you're not. Just take that first step. Take that first step and believe in yourself.
Yeah.
Maybe you should teach nursing instructors.
Yeah.
Well, there's not a school on teaching nursing instructors, unfortunately.
Yeah, I believe everything you highlighted is literally the number one issue. And, we all talk about the workplace, but I think, inside of that workplace is a huge hostile environment between us.
Right.
And I think it does start in nursing school, unfortunately. And, it continues in the workplace. From my experience, I've been in supervisor roles, and, that was one thing I was super passionate about when I did get that role. I was thankful to get it. And I was, me being a nursing supervisor, I was like, how I was treated. I do not want anybody to go through that. And I'm curious, when you were going through nursing school, was there like a moment that maybe changed your way of how to do things with education? Or was this something that was already your personality before you went to nursing? Well, not saying that you were mean before, but did this really motivate you? Was there an event in nursing school that really motivated you to get an education the way you do?
Well, it was just that back in the 80s when I went, I remember being browbeaten because I was chewing gum one time. And I remember the instructor said, spit out that gum right now. And if it happens again, I'm sending you home. I just didn't perform well. I was in my 20s. I was very backward and shy. But that kind of got it started. And then as I progressed in the nursing field and kept going back for more degrees, I just said to myself, if I ever become an educator, I'm just not going to teach that way. I don't think that's the right way to teach at this military hardline sort of thing. But I also found out that when I would get positions like you did, Will, my mentors really weren't my mentors. They were more a tormentor than a mentor. And I thought, well, where's this coming from? So I just think we have to build our work environment where we're communicating. And they've done study after study that communication breakdowns, and I think it's because of sometimes the behavior and the tone. There's research that when we speak to plants kindly, they grow bigger. So think how better it would be if we talk to people like that. Just things like that. Our work environment, and again, nursing students, and when they graduate, we want them to have a good foundation. It's stressful, and also nursing is really accelerated. There's not too many professions where you have to follow mandates. You have to wear a uniform. You have to cover up tattoos. You have to have your hair back. On and on and on. You have to work weekends. You have to work 12-hour shifts when you graduate and get your degree. So it's very, very stressful. There's just not too many professions like that. So you have to have faith. I even put it in my book. I have a lot of faith in my creator. I have a lot of faith in God. And I understand that some listening to the podcast may not believe in God. Well, you better believe in yourself. You have to believe in something, because you have to have faith to do the work that we do, because it's not easy, whether it's in hospice or wherever it might be. But
Mm-hmm.
you have to have that belief in yourself, because when you can do that, if I didn't have the faith that I had, I wouldn't have done anything. Even if you say, well, I'm anxious and scared. Well, just do it scared. I was scared many times, even when I work with our clinical group, Alexis. I didn't know everything, and I was, as you remember, we would sometimes talk about how our week went, and we'd be upset. We'd spend 15 minutes. And I had to smooth everybody out and get you ready for clinical, because we were so upset by things that shouldn't have been.
Yeah.
And so we just had to say, let's work together, and we did. And it ended up being a positive experience. But it all starts in our mind, that we have to be kind to ourselves, even our inner dialogue. Be kind to yourself, and then you can take care of others.
Yeah. One thing I love that you said earlier, and I want to highlight and kind of talk about it, is that you can't be a good nurse without being a good person.
Right.
And speak on that a little bit, because I totally experienced that. When I got out of nursing school, you can be from what my experience was, I got straight into ICU. It was a pretty big, I can't say shell shock, but it was what I wanted, but it was also a huge, learning curve alone, just from learning ICU. But, ICU nurses have kind of the reputation of being kind of the meanest nurses that you can find. And I experienced that. And from what I noticed is these nurses are super smart. There's a spectrum of being really smart, but if you're not a good person, there's that one factor that's missing in some of these nurses that are, make medical errors. And, they're the ones that are making these mistakes, the ones that are not nice people. So that's what my experience was. So from you saying that, what is it that makes these nurses, what is it about being nice as related to being a good nurse?
Well, they've done studies, and I've looked at them, that when you have a culture of criticism, a culture of bullying, incivility, errors go up. There's no doubt about that. It causes errors with the staff. And yes, if you're mean to your waiter, how can you be kind when you're with your clients, your patients? It just goes back to working as a team. But the studies have shown that, those, when you have bullying and meanness, and what's the issue there? Well, it breaks down communication, but it's really a love of power, more than a love of people. And nurses have to be people, in a business of taking care of people and talking to people. We're only as strong as our weakest link. So, and I think also that nurses forget, you were once a student yourself. You started out, you weren't an expert when you started. Everybody has a first day, and that includes the young nurses. And what I always really pray for is that, when I look at the two of you, you're very sincere. You're young, but you're loving, you're kind, you're ambitious. You really want to be quality in your work. Don't change from that. Don't let the world change you from that. Stay the way you are. Stay passionate, but preach that gospel of kindness, because kindness makes you beautiful, really, inside and out. And I always said, ugly on the inside becomes ugly on the outside after a while. But we do have to change our ways, because nursing is not just a job. I always think of nursing, when you ask somebody, what do you do for a living? Well, I drive a truck. I work in sales. But you ask nurses, I work in a hospital. They actually say, I am a nurse. You become what your profession says you are. And that's the difference, really, that we're in a life or death situation many, many times. So we've got to keep communication clear, and you've got to work together.
I know we were A question that we wanted to ask was like, so in regards to your book, like, what do you want new nurses, or what do you want nurses in general to take from your book? Like, what values do you want them to pull from what you wrote?
Yeah, I think that's a great question. What I found is, and I'm basing this basically back to myself, is I had very little self confidence. And that really hurt my career. It really did. I feel like I went 20 years because of my lack of self confidence in myself, that I didn't do the things I wanted to do. Finally, I woke up really. So, and you think, well, how does that happen? Well, some of it had to do with my environment, with the jobs I had, and I felt
Mhm.
like I was just kind of being demeaned a little bit. But also it was bad habits I had. I did a lot of negative self-talk where I would talk to myself demeaningly. You really can't be a positive person if you're constantly talking about yourself even and being demeaning. So it starts with that. The other thing I found is complaining is a real negative. Complaining is something that we think makes us passionate because we're complaining all the time. Not really, when you think about it. Complaining, and it's in the book, you get that victim mentality. You become weaker because it makes you an excuse maker. So
Mhm.
I tell all of your listeners, and it's in my book for my readers, get rid of the complaining. When you complain, half the people don't care. The other half are glad you're having a bad day. So take it out of your vocabulary, and instead of complaining, write it on a piece of paper or whatever, offer it to the heavens, crumple it up with that paper, throw it in the trash can, but get rid of the complaining, and then watch how things different. I always felt like when I complained, God left me in that situation until I changed my ways. But when you start thinking more positive, and there is power in positivity, there just is, because your body hears it, your mind hears it. You start being attracted to things that are positive. But when you complain, for example, you're drawn to things that are negative, and negative people kind of lump together. But when you're positive, and I wish I would have learned this many years ago, positive things get attracted to what you're thinking about, what you're doing. If you notice people who are smiling and positive all the time, they always seem to be happy, and good things come their way. And you could say, well, they're really lucky. Hey, yeah, you got this and got that. Well, it could be because that positive energy just drew things positive to him
Mhm.
and helped him along the way. And the other thing that I've learned is, there's a couple things I learned in my old age. And one is to be grateful for what I've got, and to be thankful. That's one thing I found, which I wasn't grateful at all in my younger life. I was very selfish, and I regret that now. Of course, you can't live with that regret. It's hard to be productive when you're regretful. But the other thing I've learned, along with being thankful and grateful, is to give gifts every day, just to give a gift. And you say, well, I don't have any money. Well, you don't need money to give gifts. A smile is a gift, a thank you, a compliment to someone's a gift. Letting someone out in traffic, busy traffic,
Mhm.
that's a gift. So I try to do at least one gift every day. And you say, well, you can't change the world by those little things. No, you can't, but you can change one person's world. And by doing one little nice gift every day, or one nice gesture, it changes little by little, until the next thing you know, that you're doing more than you ever thought you could do. So
Mhm.
Yeah.
I love that. I think as nurses, we're lucky because we can give gifts all the time.
right.
Like, I mean, we take care of people every day, and we love on them every day, and their families, and like, I feel like we have one of the greatest opportunities to give gifts and love on people and make them feel that love and support.
Yeah.
So
Yeah. I mean, people say all the time that nursing is the most rewarding profession, which what you might ask, like, what's the reward? Well, the reward is, providing a major service to a human life, not just, like little things like you mentioned, but nurses get the privilege of making humongous changes in someone's life. Whereas it could literally be saving lives a lot of the times, especially if you're in the hospital setting. And Lexi and I both have very different, we went completely opposite ways where, nursing is such a wonderful field where, you can do hundreds of different jobs and still be a nurse. The profession has all kinds of different jobs for you. So Lexi went into home health and I went in ICU, and we were completely different. I wouldn't know how to be a home health nurse, and she probably wouldn't know how to do ICU work. But, we completely were helping someone's life in a completely different way. But it just speaks to that, nurses do, like you said, have, it's good to focus on the positive things, and your perspective completely changes. And, one thing I want to ask you too is, what if, I don't know if you talk about this in your book or not, but, the nurses that come through, and this is such a huge, trend for most nurses, they get into the hospital and they're surrounded by negativity.
Yes.
Surrounded by, the patient. The patient's having one of the worst times of their lives. They're bound to not treat you nicely. The family members, the nurse manager, your coworkers. You're surrounded by negativity everywhere. Was there any like little tidbits that you have to kind of like, put the focus in on the positivity, and what are those tidbits that you have?
Well, the big thing is you don't have to always say anything. They've done studies with clients, with patients. What was it that made this nurse desirable, and what was one that made them, not very good? And one thing that was mentioned in the surveys, and we all hospitals have surveys, is the nurse came in and she took her time. She touched my hand. She smiled. She looked in my eye. Things like that. She took time to just listen to me. And the negatives were, well, they just seemed in a hurry. They didn't touch me at all. You hear things like that. And the other thing that I found, and just from the research for doing my book, is you cannot forget about the family. Will, you mentioned the family. You can't forget about the family. You have to have them part of the equation also, so that when you're dealing with a client, you have to deal with the family too. And now we're living in an age where we're getting so many different cultures. It's always a good idea, before you ever go into the room, look at that chart and find out what their culture is. And if you don't know, just when you go in, just say, can you tell me a little bit about your culture, or some things that you believe in? And just use that nice tone of kindness, which goes a long way. But again, it comes down to communication, really. I always tell my students now, because I still teach, and I'm sure I said this to Alexis and her group, there was two major areas I wanted them to be great at by the time we were done with our clinicals. Number one was improved communication skills, and number two, assessment. Make sure they can assess and know what they're assessing. I call it the art of noticing. The great nurses notice things.
Yeah.
And one thing I do remember about Alexis is, besides the fact that she always sat as close as she could to me, which I just love. She always sat in that, because my wife said, when I was talking to her who I was going to be on the podcast with, she said, do you remember her? I said, oh yes, I remember her. She said, how was? I said, she was very kind. She never had a negative word to say about anyone. And I still remember that. A lot of my students gave me gifts, and of course seems like she gave me a gift every time she came to clinical. I don't think she was doing it to butter me up. She wasn't doing that. But she was very kind and always sweet, always smiling, not always not always having the greatest week, because there's challenges in nursing. But I do remember that, in that group we had. And so it goes a long way, because people may forget about, what you look like, forget your name, but they never forget. Right now someone is remembering you, Alexis, and probably you too, Will, for the kindness you showed them. They don't remember your name, but they remember that, you during a tough time, you took care of them. You know.
Yeah, and I kind of want to go off of what you said with, like you were asking, how do you deal with negativity, that's around you? But, and I know can be really hard. And I work in an outpatient wound care center, and I have a wonderful team. Communication's great. Leadership is really great. And there has been, like when I first started, there was, a little bit of drama with another, person that isn't there anymore. But when you have negativity or drama that's kind of around you, when you're focused in on like yourself and your patient care, and that you're doing the right thing, and you're going into this patient's room, and you're going to give them your all. You're going to sit down and talk to them and talk about their day or their family, or educate them, and give them good care. Like that negativity is quieter in your head, and because at the end of the day, that's what you're there for. You're there to take care of the patient, make them feel loved and supported, and they want to come back and see you.
Yeah.
And I feel like that helps the negativity to be a little quieter. And I know sometimes it's, I guess in the hospital, I can't say, but working in wound care, we get to see the same patient every week until we heal them. And
Right.
I feel like I got into nursing for the relationship side of things, 100%. And I just get to do fun wound care as an addition. But I feel like, working in a negative environment, there's lots of opportunities out there for nurses. You can go into all different kinds of fields, and I encourage that. But also when you're in that moment, just focusing on yourself and the care that you're giving, and your patient and their family, and that bubble that you can control, because you can't control what's out here. I feel like that makes a big difference too.
Absolutely does.
Yeah.
Absolutely.
Yeah. Just going back to that, a new nurse going in, going into the field and everything, the transition to practice is definitely not up to par. That's part of the reason why we started our company, is to help new nurses transition to practice after they get out of school. And one of the things that I really made obvious to me is so many of these nurses nowadays are so task oriented, and they kind of dissociate the human being part of actually nursing nowadays, where they're very, nursing is a very cool field too, right? You get to do really cool things, putting IVs in, and you can get really skilled at these things that it does. I mean, it is a really cool thing to be able to know how to do, but I feel like it's a lot of the times these new nurses get in there, and then there's eventually that point where, just like everything else, where, you talk about the honeymoon phase of relationships even, eventually the love's just going to get normalized. Same thing with this, the love to the nursing skill side of things, that's really exciting at first, but eventually it's not going to get exciting. So a lot of times what we do is really try to teach soft skills, because nobody talks about soft skills, even in any other industry too, business, everyone would kind of the similar thing about the nursing instructors. They want to be like military,
Right.
but the soft skills, from what I found and from my personal experience too, is those little things. And the only things I remember, I don't practice bedside anymore. The only things I remember is those little moments that you have with patients that, something that was maybe a little, you did something that was just maybe not even part of the, you got them a cup of ice when they've been asking for hours or something like that, and it wasn't even your patient. And then you end up falling into this conversation with them and kind of get to know them as a person, as a human being.
That's right.
It's so easy to dissociate actual human lives in the hospital, because, you get 1,000 things thrown at you. But the things I remember are those little soft skill type things where I was able to develop a way to, be friends with everybody. And I think that's a huge skill, just even outside of nursing. And I think that's what you do too, from what you teach.
Well, I think that you really hit the nail on the head there, because it's probably poorly named, but soft skills are critical. They really are.
Mm-hmm.
And we don't talk about it enough in nursing and in education. You rarely hear a nursing instructor talk about soft skills. What they're talking about is exactly what you said, Will. We're talking about tasks. Well, it really, sometimes it's not as important how great you look in that uniform and how book smart you are. You've got to use the skills to be able to communicate with that client first, and use those skills, like that caring touch, those caring hands. That goes a long way. And I think that's probably the theme for tonight, really, is, tasks are important. It's great to know how to put those IVs in, and how to put in that Foley catheter, but you've got to have that soft skill. You've got to be able to speak to people, because you might be having the greatest day of your life because you're living your dream as a nurse, but they're having the worst day of their life in that hospital bed because they're scared. They're not going to let you know it, but they don't really want that catheter. They don't want that IV. It hurts. So how can you talk in a kinder tone and with intelligence and wisdom to help them get through one of the worst days of their life? So I think you really hit the nail on the head there with the soft skills that we really need to develop more as nurses.
Yeah.
And I guarantee patient outcomes are way better.
Way better.
There's more of those because they're more open to learning. Their anxiety levels probably a lot less. I mean, I guarantee, the patient outcome is a lot higher when you have a nurse that, is giving you that extra love.
Yeah.
Well, I really think we just focus so much on skills that we forget that communication's a skill also.
Yeah.
We're so much into making that bed and showing them, range of motion, but we've got to put more emphasis on the communication part. I don't even know if we have communication classes or chapters in nursing lectures where we talk about how do we speak, properly to the client. We just don't have that enough, and that's what I try to bring to the table. I told you I want to be different. I don't want to be a cookie cutter like everybody else. I want to be a little bit different. You can't change the world if you're like everybody else. You can't do it.
Yeah, I actually have kind of I can totally see, how, I can see if a new nurse is watching this right now and they're like, oh, here we go. Like the most general piece of advice, we're just talking about how you need to be good at communication. They probably hear it all the time, but here's one thing I would love to mention too, because this kind of reflects off my personal story going to ICU. ICU is super task oriented type stuff. You do very advanced things, and you have to know all the fancy numbers, hemodynamics, all that good stuff. What does every medication do? You pretty much are playing, you're playing with a life basically in ICU, messing with titrations and medications. You can do one little oopsie and then it's a big deal. But when I've always been passionate about treating the patient like a human being. Right. Not to say that, when I first went in, but, naturally I was very task oriented, as most new nurses are. But then I found out, and it was extremely hard for me to get adjusted, to get to the bedside. There was something missing. My days were just totally, you get home and you're like, I don't know if I can go back again. It was those types of days. But then I finally figured out that me improving my communication skills and me having better rapport with my patients and learning how to, like you said, look over the chart and, find out what you have alike with the patient and start good conversations with them. Because like you said, they're in one of the worst parts of their life. If you don't start the conversation off good, then it's not going to be good. It's you drive the conversation, you drive the relationship as the nurse. But what I found out when I found out that if I focused on that more, it actually saved me time and improved my time management and improved the things that were happening to me throughout the shift, and it improved my patient outcomes. Nursing is such a holistic, where they always say it's an art, right? You guys might, when someone's listening, they might think this sounds cheesy, but communication is that missing piece that so many nurses have that don't have. They're focused strictly on getting the task done, making sure that patient, this sounds vulgar, but, they always say patients, they don't die on my watch.
Right.
Versus, this is not a machine you're treating a human being that has complex emotions and, insecurities while in the hospital. But if you actually improve your ability to build rapport with your patients and be friends with everybody and learn how to actually, give them their needs in the hospital, not just the stuff that's ordered to you, and anybody can read an order and do it.
Right.
But if you actually learn how to be a decent human being, is what I say, and at least decent, then you as a nurse, your job will be so much easier. And I feel like we would hear less complaining. I was curious in what your thoughts are on that.
Well, you said art, nursing's an art. Florence Nightingale said that. She, back in the the 1800s, she's the one that came up with that. Nursing is an art, and that means that we have to be creative and we have to find ways to reach our clients. And it starts with just being a real person and being real. There's really nothing worse for us than to be a phony. We want to be real and genuine. Why did we get into nursing to begin with? Well, we wanted to help people. We wanted to be caring. And really, there's nothing worse in my 40 years that I've seen is when I see someone who I saw at the beginning and they were genuine and caring and loving, and I see them 5-6 years later and they've turned into a hard, soft or hard talking veteran. And it's like, what happened to the softness that I saw 5 years ago? Because our clients need us, but I think sometimes we forget too that our colleagues are also are part of the equation. That we don't know what struggles people have. They're not going to come out and say that I have this problem. But taking care of patients is challenging. It's not the easiest thing. A lot of people in the workforce don't even want to go into nursing because of that. For us to bring them back, it helps what you're doing. I think you're doing great work, and I really applaud you for that. But to get the message out, of anyone who's listening, is believe in yourself and work on your soft skills, your communication, and just kindness. Like I said, kindness makes you beautiful. It's a way of life. And I think clients, patients appreciate it. Your colleagues appreciate it. And also work on your communication skills, that by just really looking at your patient, saying, what are you really saying? We can hear, but sometimes we don't listen.
Mm-hmm.
We can talk, but we're really not communicating. And I think that's where the breakdowns come in. And Alexis, you spoke a few minutes ago about the outcome, and I think that's what we need to really focus on. There's an old saying in nursing: it's not about the income, it's about the outcome. Money is there, but money will give you everything but happiness. Happiness is free. So we want to work because we want to support our family, but we can't work for the money. We have to have more than that. Mm-hmm. And I think for the most part, most nurses are decent, loving, caring people, but we've kind of got away a little bit with because society changes, and we know that society takes this hard line, but nursing can't follow that line. We can't be like the world. We cannot be like society. There can't be road rage. And Will, you talked about drama, and I've seen drama too much in clinicals and in hospitals also. We should leave the drama in the Shakespearean plays. We don't need drama in nursing.
Yeah.
Nursing should be where we're working together as a team, and we're working to come together as a group, and we're going to show we're like a family away from our family, and that's really what nursing should be. And unfortunately, it's gotten away with that. Years ago, I don't know if I mentioned it on this podcast, but I tried to get out of nursing. I was going to go into another field, and I was going to go back to college and start all over again. And then I looked at all the money I had spent and all the experience I had. I thought, no, I'm not going to do that. So I just went back. That's why I went back and got a master's. I thought maybe I could make a difference. And then I thought I was done. And then I got the call from above to go back and get a doctorate, and hoping that I could make a difference. And it's taken me to this journey where I get to meet beautiful people like you, and and some of the other great patients I've had. I've had a great journey, and it enabled me to write a book, and I'm hoping to write more actually. But
Cool.
again, it's called, in case some of your listeners are just coming in now, it's Smart Lawyers Love Dumb Nurses. And I want to emphasize, it's not putting down the nursing profession. It's just to get your attention. There's a method to my madness in it. But sometimes my students will say, we are not going to be dumb nurses. We're going to be smart nurses, and lawyers are going to hate us because we're smart nurses. And so I always appreciate that. But
yeah, well, cool. We'll link your book to the bottom of our podcast, wherever we post, and we'll put a little clip of your book on here as well. So
I would love to have that.
Yeah.
I would love that.
Well, thank you so much for taking the time.
Yeah.
Out of what is today? Monday.
Monday.
No, yeah, okay.
Yeah, it's Monday. Yeah, and I'm super intrigued. I'm definitely going to be buying one to read it because if you guys didn't listen on early on, that Brian's one of those people where, he really stands out, and he's not standing out because he's, trying to get your attention or anything. He stands out because he does things so different than what all of us are used to as nursing students. And unfortunately, like we talked about,
right,
where it's the military style of teaching, and they're trying to intimidate you. There's nursing instructors trying to intimidate you, whether, some of them can be doing it out of love even, but, it's not necessarily the most therapeutic way of doing it. And I think, right. Brian, I think your book is going to make a huge difference for a lot of people, because just from knowing you, I know this book is probably a masterpiece on getting a nursing student, new nurse, or even an experienced nurse through the struggles that they're bound to go through sometime in their career.
That's right.
And I think it's super cool that you've went through, the roller coaster of nursing. You went through nursing school and had that bad experience in some ways. And, you went through the bedside, and then you've, like you said, contemplated on going into a completely different career.
I did.
And now you've done the full circle where you are helping other nurses. And I think that's a beautiful thing. So I'm super excited to read that. And I encourage anybody who is interested in, changing perspective and improving your livelihood as being a nurse, because like we talked about the positivity, I totally encourage you to go buy it.
Thank you very much.